If you have lower back pain, knee aches, or poor posture, and you sit for most of the day, your glutes may have stopped firing altogether. Not weak, not sore, just switched off. This is called dead butt syndrome, and the clinical name for it is gluteal amnesia. Most desk workers have it without knowing it. In this video, you will find out exactly what is happening, why your back and knees are paying the price, and the one move that starts reversing it today. Let us start with what it actually feels like. After sitting for several hours, the glutes feel dull, numb, or disconnected rather than sharply painful. When you stand up, there is stiffness, an awkward feeling, as if the muscle is not quite responding. The discomfort you notice is usually not in the glutes at all. It shows up in the lower back, the hips, or the knees, because those areas are now doing the work the glutes abandoned. Visually, it is subtle at first. A slight forward tilt in the pelvis, a small increase in the arch of the lower back, hips that drift or drop when walking. On stairs or when rising from a chair, the movement looks and feels clumsy because the glutes are not controlling the pelvis the way they should. The lower back, thighs, and knees compensate instead. Think of the glutes as the body's rear stabilizers. When they stop contributing, everything above and below has to work harder. That is why desk workers with dead butt syndrome rarely feel it in their glutes first. They feel it everywhere else. So why do desk workers get this more than anyone else? Every hour you spend sitting, your glutes are lengthened and doing almost nothing. At the same time, your hip flexors, the muscles at the front of the hip, are shortened and tight. Over weeks and months, that imbalance shifts the pelvis forward, changes how you carry your weight, and gradually teaches the glutes to stay out of the conversation. The problem is not one long sitting session. It is the repetition. Day after day, the body learns that the glutes are not needed, and other muscles take over. By the time you notice the lower back pain or the knee ache, the pattern has already been building for a long time. You can fix it by moving more deliberately. Stand up more often, walk during your breaks, and give the glutes regular work through a small set of targeted moves. The goal is not just switching the glutes on for a few minutes, it is rebuilding the habit of using them so the pattern changes permanently. Most desk workers notice less stiffness and better movement within 2 to 4 weeks. Meaningful strength and control usually follow by 6 to 8 weeks of consistent work. The symptoms often improve faster than the full movement pattern normalizes, which means you will feel better before you are completely fixed. That is normal. Keep going. The one move to start with today is the glute bridge. Feet flat, push through the heels, lift the hips, and hold for 2 seconds at the top. 10 repetitions. That is it. It is the simplest way to remind the glutes they still have a job to do. If you want the full 4-week plan, every exercise, every progression, and exactly what to expect each week, that is the next video. The link is on screen now. Train smarter, not harder. Thanks for watching.